Sometimes it's not a personal health issue that won't go away, but a health trend. Nearly 4% of pregnant women use illicit drugs. Over 500,000 babies are born every year exposed to drugs or alcohol in the womb. These abandoned babies have medical issues that make them unpopular for adoption, but you're about to meet a nurse who stepped up to fight for them.
My name is Linda. I've been a registered nurse for more than 25 years in neonatal and pediatric intensive care. More than a decade ago, I saw the increase of methamphetamines come through our nurseries. So what I was seeing is these mothers not being able to test negative in test results to get their infants back. And as a result, the infants, sometimes even before they were born, became wards of the court, aka foster children. 8 years ago, I was raising 2 teenagers. I was kind of going through the empty nest syndrome, so I decided I was going to look into medically fragile foster children. I went through the process and became licensed to be a medically fragile foster home. I received a call from an owner of a group home that had a 24-week preemie that spent his first 18 months in the hospital due to complications due to his prematurity and his meth exposure from his mother. His name was Sammy, and she requested for me to take him home because she was very concerned that if he went to the institution that he was slated to go to, that he would come down with a condition called failure to thrive and give up the will to live. I walked into the home and there was a little boy sitting at the table. He suffered from a condition called hemangiomas, where he had all these kind of blood tumors all over his face. And he just looked at me with these brilliant blue eyes, and my heart just dropped right then. I created Angels in Waiting, a nonprofit organization of nurses recruiting nurses to become medically fragile foster parents. It's a program where nurses are able to clock in at home and care for medically fragile foster children. I can honestly tell you that clocking in at home and doing medically fragile foster children isn't for every nurse. It's the most challenging nursing career, but also the most rewarding.
After Linda started Angels in Waiting, it was only a matter of time before other nurses joined in.
My name is Lisa, and I've been a nurse for 23 years.
My name is Donna, and I've been a nurse for 8 years.
We were talking to a social worker, and she introduced us to the idea of doing foster care.
Linda came onto the unit one day, and she was caring for a child that she was going to be taking home, and she started telling me about Angels in Waiting, about taking these kids home, being their foster parents.
So we got started in the foster care business through Angels in Waiting.
I knew in my heart that this was something that I wanted to do.
They called us and asked if we wanted to have a set of twins in our home, and we said yes.
I went home and told my husband, and we agreed this was going to be foster. This wasn't going to be an adoption.
Sarah and Emily were born 3 months early. Sarah was 1 pound 12 ounces, and Emily was 1 pound 9 ounces.
Alex was born about 4 weeks premature, and he was born with a condition where the abdominal cavity doesn't form completely, so his intestines and his bladder were on the outside of his body. I just thought it would be a wonderful thing to be a part of, to help another human being.